Hi, my name is Tiffany Alley, and I present to you Struggling in Silence. The mental health epidemic from the youth perspective. What does it mean to struggle in silence? Many youth and young adults are struggling with their mental health at an alarming rate. According to the American Society for the Positive Care of Children, suicide is the third leading cause of death amongst youth and young adults between the ages of 10 and 24. It is also more prevalent than certain major diseases such as AIDS, pneumonia, and cancer. For this reason, the Jason Foundation coined the term silent epidemic as a reference to children who are silently suffering from a mental crisis. Our roles defined. This is an area of interest due to personally experiencing many youth expressing their suicidal ideations. Um, Worked in several jobs where there are a lot of youth and young adults who are struggling with their homes, um, many pressures being placed upon them, whether it be from pressure at home to bullying and even the pressures they place upon themselves to be overachievers at school. Within the school system, the students are comprised of many different backgrounds and cultures. For this, it may be hard to pinpoint the exact cause of the mental distress of the student. However, if we are able to provide an open space for the youth to speak, then perhaps that more lives would be saved and more coping skills or preventative resources could be utilized. Past interventions. In a 2014 study by Strunk and other researchers, the preventative measure that was researched was the Surviving the Teen Suicide Prevention and Depression Awareness Program. The researchers utilized control and test groups to research the effectiveness of the program. At the end of the research, the researchers found that the test group had a more positive outcome than the control group and were able to express themselves more, which aided in a healthier mental status. In another study in 2020 by Hart and other researchers, the researchers conducted a study on how effective teen mental health first aid was at a school based intervention. The program was to provide education and resources on how to recognize the signs of suicidal ideations and how to help as a peer. The researchers found the results to be positive. The participants felt more confident in with recognizing the signs of mental crisis. With these interventions, it is important to note that there were participants that felt distressed by the program. This could have had a negative effect on the program should the program have been too rigorous or too traumatic. These interventions can be utilized in any school setting to bring forth awareness to all and open up a safe forum for those who are seeking help. The proposed intervention is creating an after school program where teens can meet and discuss topics related to suicide prevention and mental health awareness. This program will also provide resources to teens seeking help. Planning. In order for the intervention to come to fruition, one must be able to identify the stakeholders in the community um, and or the political thought process around the topic. There is ongoing conversation within the legislation regarding suicide prevention and mental health awareness. Currently in Tennessee, there is a bill waiting to be passed that will require schools to add mental health resources in the 988 crisis line on the students' IDs. This will promote awareness The Jason Foundation, which is founded in Tennessee, is another indication that Tennessee is a state that is open and committed to the safety and the well-being of the youth in their mental health. As a social worker, it is our duty to uphold the values of the NASW Code of Ethics and Values. The value used here would be the value of service. In order to better serve the communities, one must gain an understanding of the multiple cultures within the community and how they may have an effect on the child's mental health. Also, how well each culture interacts with each other. Following the engagement is the assessment. The problem of a decreased mental wellness amongst youth and teens is increasing at an alarming rate. In order to decrease the suicidal ideations and the depression, one must meet the youth where they are. Having an after school based intervention could help ensure that the youth are in a comfortable and safe place to freely express their emotions and learn different skills to help decrease the negative thoughts. Strategy and goals. The strategy is to develop an after school program that will allow the students to learn about mental health awareness and to have an open forum for those who are experiencing a mental health crisis. Each session would include representatives from surrounding mental health centers and foundations such as the Jason Foundation. The goal is to ensure that each student is equipped with the knowledge and the skills to recognize and mitigate a mental crisis, either within themselves or with a peer. Teachers and principals will be in charge of leading the discussions with the help of a mental health professional, such as school psychologists, to help build rapport with the students. The students will be given homework on to work on, such as coping skills and learning warning signs of depression and other mental crises. By the end of the program, the students should have an increased knowledge about mental health awareness and feel more comfortable with expressing their feelings. A possible challenge would be transportation, as not all students have the capability to have a parent pick them up after school. Another challenge would be for the students to fully engage because not all of them have the buy-in or feel comfortable enough to engage with other teachers and other students. In the end, the youth are looking for help. If suicide is the third leading cause amongst youth and young adults, then that means most of them are suffering in silence. It takes a village of people who are willing to listen and engage with the youth that are hurting. In order to slow down that silent epidemic, holding after school programs that engages the youth in learning about the positive effects of coping skills and resources that will aid in a decrease of a mental crisis is the key to a mentally healthy future for society as a whole. Thank you.